As America fights against coronavirus, remember, for all of its flaws, we still have one of the best healthcare systems in the world. But what about the developing world? As we know, this virus continues to spread across the globe. Europe, Asia, and of course, North America have been hard hit by COVID-19. The virus is now on every continent except Antarctica. But tonight, we turn our attention to South America, specifically Ecuador, where in one city there are body bags literally in the streets. Victor Oquendo has a horrifying look now at what this pandemic could do to nations with less robust medical care.
The images are hard to bear. In Ecuador's port city of Guayaquil, officials have been struggling to keep up with the surging number of deaths. It's a fate no one should have to succumb to. The indignity, bodies abandoned on streets, families pleading for help. As this virus spreads, it's a glimpse of what it could do in the developing world. A nightmare with no end in sight. Everywhere you look, there just aren't enough resources. The morgues are at capacity, so they place bodies inside shipping containers, stacked one on top of the other, as families try to repatriate their loved ones. Marcos Ortega went looking for his grandfather.
Ni siquiera se dignan a entregarle los cuerpos a la persona. Estoy aquí, ya tengo, hoy día mi abuelo ya cumple ya 6 días ya de haber fallecido. Estoy aquí día, tarde y noche, duermo aquí, amanezco aquí.
There's no reprieve from a grim fate here. Doctors say there just aren't enough medical supplies to treat everyone. Dr. Esteban Ortiz Prado is an epidemiologist consulting the president and other high-level officials during this pandemic.
And those patients that are older will die with no medical attention in hours. So if you don't give them a respirator, in hours, they will die. That's why the mortality rate is so fast in Ecuador in relationship with other parts of the world, because these people just didn't get the chance to get medical attention.
The crisis has left the local and federal government scrambling. At one point, Guayaquil's mayor took to Twitter pleading for help. Now, thousands of these cardboard boxes are being distributed in place of coffins. A special hotline has been set up for those waiting for bodies to be removed from their homes. The line to bury the dead is endless. Others decide not to wait. They dig their own plots. Governments are meant to protect its most vulnerable, and the Ecuadorian government knows it failed.
The response in managing bodies and corpses was also a mess. In managing hospital personnel was also a mess. They didn't hire people fast enough.
Officials tell ABC they believe they were able to trace the outbreak back to at least 2 people and places. The first was this soccer game where at least 5 people tested positive. And then there was this woman, Bella Lamila, who we're told had traveled from Madrid, Spain. She died March 13th. But the tracking, like in most of the world, came too little, too late. And there just aren't enough tests here to track all of the country's cases. There won't be accurate numbers to show the breadth this disease has had on the Ecuadorian people. Their only proof? The cadavers on the roads, waiting for a proper burial. Victor Oquendo, ABC News, Miami.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.